Let's start with some definitions. Weight bias refers to negative stereotypes or attitudes about individuals based on their weight. For example, assumptions that people living with obesity are lazy or lack willpower. Weight stigma is when these biases turn into actual discriminatory actions or treatment, things like being treated disrespectfully or experiencing social rejection. Over 40% of US adults report experiencing weight stigma at some point during their lives. Experiencing weight stigma is not just emotionally damaging, it has measurable effects on physical health. It's associated with maladaptive coping behaviors like binge eating, avoiding physical activity, delaying medical care, and can contribute to depression, anxiety, and worsen cardiometabolic health. So weight stigma is not just about hurt feelings. It's a real public health issue that impacts mental health, physical health, and access to care. While weight stigma is well known to harm health, little was understood about how the timing of obesity onset might influence a person's lifelong risk of stigma. With childhood obesity rates rising, we wanted to better understand which patients might be most vulnerable. In our study, we found that adults who develop severe obesity before age 18 are nearly 3 times more likely to experience severe weight stigma later in life. This highlights how the early onset of obesity can have lasting psychological and social consequences. What we found is that one of the most stigmatizing experiences that our patients reported was that in the past, they'd gone in to see a healthcare provider about an unrelated health issue, and a diet was recommended to them. One take home from this study is that we need to meet patients not just where they're at, but know where they've come from. So a patient could come into your office and they may be highlighted because their BMI is 30, which puts them into the obesity category. But what that clinician may not know, unless they take a comprehensive history, is that person's BMI may have been 45 before. And so what we need to do is make sure that we, as a part of a comprehensive intake for somebody with cardiometabolic disease or other health complications, that we look at their weight, not just in that one moment, but what it's been over their lifespan. One of the challenges with experienced weight stigma, particularly in a healthcare setting, is that it can decrease patient engagement with healthcare in general. For example, if a patient has a negative experience with a clinician, they may be reluctant to go back to see that clinician again for a related or even an unrelated healthcare issue, such as going for regular screening like a mammogram or colonoscopy. It's really important for us to create judgment-free environments where patients can feel that they can come to us regardless of what's going on with their weight. With rising rates of childhood and adolescent obesity, this means that more individuals are at risk of lifelong stigma and its health consequences. Early onset obesity can set the stage for a lifetime of stigma. Recognizing and addressing weight stigma needs to be part of routine obesity care. And for clinicians, this means that taking a full weight history, including the age of onset of obesity, can help to identify patients who are at greater risk for experiencing weight stigma. If we truly want to improve health outcomes, we need to treat obesity without judgment and to tackle stigma as seriously as we do other health risks.